wasn't here, I don't think I'll be alive. It was like what I like to call my guardian angels, in the flesh, To all staff on the ICU ward and wherever I've been in the renowned hospital, thank you, I appreciate it, and kudos.
Patient monitoring. So the idea of, survey was one of the catalysts, among other factors, to break this into our organization, to make it part of our strategic priorities. And we utilize it for blood pressure monitoring. And the initial data is very, very positive or encouraging. When we track those patients over a period of time, we see, a significant reduction in their blood pressure. And we all know, right? Just because this RPM, that's not clinically doing anything. It's about active monitoring and care coaching. So the more you monitor, the more careful you as a human being are. So in some cases, we have seen almost 20-30% reduction in the numbers for the patients over a period of time. So definitely something we looked at post-wire survey, something we looked at our peer comparison, part of our strategic plan, and we implemented.
Advanced Care at Home is UNC Health's Hospital at Home program, which delivers hospital-level services to patients in the comfort of their homes through a combination of in-person care and virtual care. Our program is designed for patients who are acutely ill enough to be admitted to the hospital as inpatients, but not requiring critical care or step-down care.
Immediate benefit. I'm in my own bathroom rather than behind a curtain. I'm in my own chair. I know where things are. Yes, I'm still short of breath, but I'm comfortable.
Patients are now able to get that care at their homes, and they're around their pets, they're around their families. Statistics show that if patients are at their homes, they recover faster and they recover better because they're around familiar place.
But there's two areas where we really look at, and one of the areas you have to think about is that we don't just, when they get to the hospital or they get in the institution, sometimes it may be a little bit too late. And what we want to do is really reach out and go back to where is the patient, or actually not even the patient, but the individual, and look at that 360-degree view of the patient, and where does their care actually start, and how does that patient or that individual, take care of themselves, and how do we help them do that as well? But really, that's looking at remote patient monitoring in the home. And what we found out is we use Geek Squad, and in 2021, we worked with home care through Best Buy's care at home platform called Current Health. And we advanced our innovation through a partnership to really deploy Geek Squad agents for device installation and activation. And we've benefited 300 patients so far. Of all the patients we've had, 50% had a faster time to activation, 90% had improvement in patient wearable adherence, and 80% had improvement in their technical alert burden. So we have a team that's looking and monitoring the events that are taking place, and they're making adjustments based on that. So in essence, we saw overall from August 2022 to 2023, we saw a 20% improvement in our patient net provider scores.
My name is Rick, and we're in Lock Haven, Pennsylvania. Been married almost 23 years. I'm a girl dad, so it's sometimes pretty challenging. I had double lung pneumonia from COVID and acute respiratory distress syndrome, which typically is fatal. I was in the hospital at Geisinger for 42 days, then transferred to another hospital where I had my lung transplant. Geisinger gave me a second chance, and they gave me my life. They gave me my family back and gave me a new respect for people and humanity, gave me more faith. They gave me everything.
One of the things that I thought was kind of interesting is that, we really, and just recently won a CIO 100 award regarding our telehospitalist program that we're doing within the organization. Thinking about ways and in innovative ways that we could be thinking about expanding out the physicians that we have within the organization to some of the critical areas or critical access hospitals that we have in some very rural locations of Wisconsin. And so we were able to use telehospitalist program by having a nurse practitioner actually staff the hospital, and then being able to bring in the specialties necessary from more of our flagship hospitals based on, the criticality of the patient. So we didn't have to spend the time transporting the patient to a higher, more costly, higher acuity facility. We were able to keep them into a lower cost facility by bringing the physicians to them through the telehealth hospitalists and virtual health programs that we have, which were some of the ideas that we got from just looking at the survey and understanding what other organizations were doing.
I woke up, actually it was about 3, and I had heartburn that I don't think I've ever experienced quite that bad before. And I woke up my husband, and then I decided it wasn't a good time to get him out of bed, so I tried to go back to sleep. And when I woke up at 7 a.m., I called the clinic and made an appointment for 9:15. And arriving at the clinic, I got in promptly, and I saw a doctor I had never seen before, but he was very nice. And they took an EKG and said, "I think you need to go to the emergency room." They had forwarded my EKG as far as I understand. And a doctor in Marshfield saw it, and I think I heard this voice, and I can hear it yet, saying, "That woman is having a heart attack. Get her to the cath lab immediately. I have ordered a helicopter." I had a heart attack, or was having a heart attack actually, in the emergency room. So they did all they could, I feel like they did, to slow it down. And then when I got to the cath lab, I had a stent put in. I had complete faith in all the staff. I mean, the medical people, I had complete faith. I would just say thank you. That's all. What else is there to say? Appreciation, understanding, they were so empathetic.
Every day, we are an extension of the caregiver, we're an extension of the patient, an extension of their family. When we have a bad day, what we think is a bad day in IT, we're not having a bad day. Think about folks that are getting news that is devastating, or news that is celebratory, a baby, a new birth, whatever it may be. And think about that caregiver. That's that person that's doing the direct hands-on with that patient, their family, etc. We are an extension of that. We may say we're twice removed, 3 times removed, but frankly, and especially as the years go on, there's more reliance, as we know, I'm preaching to the choir here, on technology. And if it doesn't work, shame on us, because it has a direct impact on patient care.